First of all, thank you. It's an honor to be here. I really was excited to bring this talk, and happy that I had the chance to meet Talia and talk to her. And it's amazing what you guys are doing. So congratulations. So I'll get started. Who I am. So right now, today, from a professional standpoint, I am a trauma critical care general surgeon. So here in the United States, we do have a subspecialty after general surgery where we spend a year training in the critical care world and trauma, and we get board certified. So I have a board certification from the American Board of Surgeons as a general surgeon, and then my subspecialty is in trauma and critical care. I trained 14 years ago. I finished my training, and I've been a staff here at Mayo since then. And I'll tell you a little bit. You're gonna understand how in the world I got here based on the talk today. I am an associate professor in surgery within the levels of professorship, and I used to be program director for the Surgical Critical Care Fellowship, an associate program director for the residency, and now I'm the program director for the general surgery residency, as mentioned. I have been involved within Mayo in diversity groups, specifically for the Latino group because it's the group that I identify. I go by pronouns she, her. I am married to a fantastic husband. Today is our 19th year anniversary. I am mother of 3, and you'll get to meet them through this presentation. Once again, I do identify with the Hispanic and Latino community because I'm Puerto Rican. And I have passions, and my passions are what have brought me where I am today. I do have a passion, and my why is helping others. And that why I do it in different ways, by being a doctor, obviously being a surgeon, being an educator. I adore traveling. I adore teaching, and that creating those connections between friends and family. Those are really my passions today. So life has been amazing, and that slide is all the amazingness things I have done. I'm extremely proud that I've done that, but I'll tell you something. There's something that I've learned through this process is how to fail. And I think that's going to be the key of this conversation today is how have I failed? What have I learned through those failures? Which I do believe that each one of them are the reason that have brought me here and have brought me this success. So if I would have choose one picture about my life, this is it. This is my life. There is absolutely nothing about a straight line. It turns upside downs and going up and going down, and I think that that's just life. And this is my story. But yeah, if I think about it, this is it. This is how my life has felt. It's a roller coaster, but a cute roller coaster. That one was. I'll tell you a little bit about my story, how I am an adopted child. So I'll tell you a little bit more about that. I was raised in Puerto Rico, which is what home is, and I'll show you where in the world is Puerto Rico. I'll tell you a little bit about my personal life, my professional life, obviously, and then all of those lessons learned. And at the end, I'll give you some practical points about what have I learned from those failures. This is me in the OR, which is my happy place. So as I mentioned, in August 28, 1977, so if you're doing the math, I am 47 years old. I was born in Colombia, a country obviously in South America. My parents gave me an adoption. I was so lucky to find 2 amazing parents that adopted me and brought me 3 months later to this tiny little dot in the Caribbean Sea. To give you some idea, I'm up here in North America. And then I was raised in this tiny little island in the Caribbean, which is called Puerto Rico. Extremely grateful for the opportunity that I've had and being raised in there. Where is I call home? I just came back from there yesterday. It's just simply home for me, and it's where I've been raised, felt the love, and where all started, right? Because all of our stories start somewhere. This is where it all started. I come from a socially, economically very humble. My parents both worked so that we could have money, so extreme middle class the most. They were first generation college graduates. Nobody else in my family were a doctor or anything rather more than the 4 years of college, which is our bachelor here. But they prioritize education. They've always told me the only thing we want to make sure that you have in your life is that you get educated. So they did a lot of sacrifices to get me to good schools at that point in Puerto Rico. And I was privileged to then study my major or my bachelor degree also in Puerto Rico. That was a choice, but it was, they couldn't afford getting me elsewhere, to be honest. So I did my best to get into the best university in Puerto Rico, which I did. I did a major in basic science, and I had a minor in art and Spanish literature, which is something that has it's kind of a hobby for me. Why in the world I wanted to be a doctor, I have no idea. This is my now 10-year-old. She was about 4 or 5 years old, playing doctor, and I don't have a picture like this, but probably because at that time we're not taking as many pictures as we take now. We're kids, right? But the day I was born, I don't know, since the day somebody asked me, what do you want to do? I say a doctor. And I have no idea where that came from. Absolutely no idea. No, again, nobody else around. It's just, I believe totally that it was a calling for me. In 1997, my life changed. I was all ready. I was in my 3rd year of college, getting good grades, and doing everything that I needed to do to get into medical school, which was the next steps, obviously. And in 1997, I got pregnant. The father of my daughter disappeared. So nobody there. And I put this blue sky because I remember kind of realizing like, oh my God, things are changing. My path, that clear path I had delineated and I had achieved so far became unknown, right? And then I remember looking at the sky. Puerto Rico it's in the Caribbean, so we have beautiful blue skies every day. And I felt that sky had changed. I could see it from a different world. And that was a moment where I realized things changed. Single mother for 6 years, and this beautiful lady here was born in August 1998. She's now, oh my God, she's now 26. She just finished law school. She's a lawyer. She decided to go back to Puerto Rico. She's engaged. She's going to get married in December 2025. You'll hear a little bit more about it, but she's definitely the biggest failure or the biggest success in my life, if you think about it. So life changed. Now I am with her as a single mother, and I'm faced with a decision whether I'm going to go to medical school or not, which is why I bring it into this conversation. Because very early, even before medical school, life stopped me and say, hey, you better think what you're going to do, because are you really going to be a doctor? You have no idea how many people that love, wonder, and question whether I should continue with that dream, whether I should continue with that pathway. I had to learn to find my inner strength and not the strength in others. I had to learn how society defined me and choose what things were good for me to make my own decisions versus what was noise, what really didn't matter. I had to figure it out and very early in my life think about what made me happy. I remember the moment that I said, I want this child to have a happy mother. That's the only thing she has. I had a huge family, and I still do, and I have a tribe, and thank God for them that they helped me raise this child. But I really needed to sit down and think, what is going to make me happy? Because this child deserves a happy person next to her, a happy mother, a model, right? Of what do I want? And that was the moment that I said, okay, I am going to continue to medicine no matter what, because I am going to be happy if I am a doctor, and then she will have a happy mother. That was the process. That's how I decided. There were so many. You will not be a doctor. You will not be a surgeon. You will not be a good mother. You will not get married. You will not have a happy life. And I remember all of them. And for me, those are the gasoline in my life to push me and prove them wrong. I have all of them in my head. And how many times I've been able to tell those you will not, you were wrong. I could do it. You really think when you're going through this time in life, you really figure it out who are your real friends, what love is, and what support is. And again, I was blessed to have my support group. This is me down there, very, very different from now. I was probably in my 20s there, my mother and my grandmother, and this was the people behind me that really push me and supported me and say, if you want to be a doctor, go for it. I did my medical school in Puerto Rico, and within the Recinto Ciencias Médicas, which is the one of the biggest and oldest medical school there. I knew I wanted to be a surgeon. That journey was bumpy because, as you can imagine, I was raising a child at the same time that I was doing medical school. I couldn't figure it out exactly what I wanted. I really didn't enjoy my internal medicine rotations. I really didn't enjoy pediatric rotations, radiology, and I thought, okay, I'm doomed. I picked the wrong profession until the day that I did my rotation in general surgery. That day, once again, pivoted and changed my life. There was a lot of trauma, there was a lot of surgery. I saw brains coming out, I saw abdomens, I saw poop, I saw bowel. It was extremely intense, but I could feel myself there. I could see myself there. It was one of those moments in life that you're like, yes, this is it. And, I'm going to start working toward that journey. I'm going to toward the goal of becoming a general surgeon. But medical school was rough for me. I did my best. I got the best grades I could. It was not perfect. I was raising this child. I say I need a break before I go into general surgery. So I didn't apply to general surgery right away. I took a year where I was working. I was still working as a doctor in what we call a transitional year in one of the hospitals. I rotated through surgery. I rotated through other specialties. It really, really, really gave me a year to think about really, what I wanted, but also gave me some time to be a mother. So kind of balancing that out. Then the year after, I applied. I only applied to Puerto Rico. At that point, there was only one residency. I definitely couldn't go anywhere because I needed my support group as a single mother, and I got into general surgery. I did my 5 years of general surgery there. And between year number 2 and 3, I did 1 year of research at that point in breast surgery, breast cancer surgery, and it was an amazing opportunity. So still home, still within what I could do, balancing this thing called life and raising that child at the same time. But life happens, right? There's a lot of things in life that you can control, but there's a lot of that you can't. And in my life, away from my professional life, that one I was all focused about profession, even with Lara born. But this gentleman here appeared in my life, and we decided to get married. He adopted Lara, and then together we had this other two daughters here. So we got married in 2006, but 3 years ago we got married in the Catholic Church, and this is that picture of that. So I did things kind of in a different order. I guess that's part of this journey. And now Lara is getting married to Caleb, which is Caleb is from here from Rochester. He moved down to Puerto Rico to start a life with her. So this is a picture of my life now, and one of those reminders that you can plan as much as you want your professional life. You can make all of these decisions, all of this plan, but life happens, and you have to embrace life, whatever it is. You have to embrace what happens into your life and make the best out of it. And I think this is one of my happy moments when I got to do one of those things that people told me I was not supposed to do. I was not supposed to be in the church getting married with a white dress to anybody because I had Lara earlier on. And this is a testament. This is a picture that reminds me of I did it. Don't tell me that I can't, because I will. And life, again, brought me to Mayo Clinic. How in the world that happened? I was in Puerto Rico in a American College of Surgeon meeting, and two of the trauma critical care fellowship directors were there. And they were talking to another surgeon that trained here and was staff here. And they were looking for a fellow. They didn't fill their positions. And they literally met me there and offered me the position. I had to Google where in the world was Mayo Clinic. I had no idea where Minnesota was. I had no idea how cold this place was going to be. I literally called my husband. Between he and I, we Googled it, and 2 months later, we were here, and I was offered the position. I came as a 1 year. I came for my fellowship, which was the critical care fellowship of the general surgery. And my plan was to go back home. I never saw myself getting out of my country. As you can see, there have a lot of things I've gone through and very, very strong roots in my country. Never see myself living here. My husband had different plans. He wanted us to stay here. And in 2010, they offered me a position. I started as a young consultant. I had no idea, consultant or faculty. I had no idea I was going to stay here. It was not my plan. Why would the Mayo Clinic want me? I'm not from here. Why would I even consider? And today I'm 14 years later and I'm still here. And I have to tell you that I've been once again blessed with those things that happen in life. I would consider myself an average learner. I am not one of those that read the book and immediately can answer the test. I am an intelligent person like all of us are because we are in this world, and I had enough of an IQ to answer the test and understand and have clinical judgment. But I struggle. I struggle a lot. I had to take my oral course 3 times. You're supposed to take it once because I couldn't do it. I couldn't pass. And thank God to the people here in my offices that helped me, and I was able to pass my 3rd time. That was a failure. That was an F move, but something that definitely taught me a lot. Because I consider myself one of those average. I'm passionate to understand what is the science behind education and learning, and how adults learn, from the average learner like myself or the super extremely intelligent learner. How do we help? How can I create the best environment that all can learn? And the best way to teach. In journey took me to the world of simulation. In 2019, I became the guest to participate in the simulation sessions on Fridays. I was part of building that session. Dr. Farley started it. I continue it, and now I am transitioning to Dr. Diembu. I still go there. I still adore teaching using simulation, using my hands, making them think, identify what are the failures, and this is all based on adult learning, education, science, which again has become my passion and my world of research. Coming and staying in the United States was a culture shock. We have been part of the United States for many years, and there's a lot of things that I've learned. I visited the United States multiple times maybe before, but it's never the same as to live here. Changing your space and going away from those strong roots have been a source of learning for me. I miss my tribe. I miss my family. Here are my parents, my cousins, the daughters, the cousins, my uncles. This was the people that supported me for years before coming here. And living without them has been something I had to learn. The weather here is not easy. It's a very cold weather, and coming from a tropical island, I had to learn how to even dress here because I had no idea. Raising my daughters away from my culture has been another thing that I had to learn, because I still wanted to raise them within the culture. And I didn't want to deny the good things about either culture and acknowledge maybe the less positive things of either one. So I decided to raise my daughters in both cultures. I had to find my support group, my friends here, my tribe here. I struggle with the language. English is a second language for me. I had to literally learn how to speak properly here. I had to take time to slow down how fast I talk to make sure that people could understand me. To this day, there's words I try not to say at all because they just don't come right. They come out and I couldn't even understand them. So that is something I had to learn. There's this sense that you have to fit in, that you have to become them, that you have to become the culture, that you have to one of them. And that is I struggle with that because there's no way that I can suddenly become them. I am not. It's my background, my language, even how I look. We obviously have a difference. And loneliness is something that is true to the medical world because we spend so much time in this hospital. We spend so much time taking care of patients. And then loneliness can really affect you. So something to think about. This picture was taken Thanksgiving Day, 2 days ago. I because I went back home for Thanksgiving and it was great. It was great to be there. So what have I learned and how I am an extremely happy person here and I am grateful about all the opportunities. But I had to sit down and I do this exercise every single day. I think about three things that I'm grateful from the day before. That's as soon as I wake up. I don't look at my phone. I just put my alarm down off and immediately the three things I want to think of, three things I'm grateful from the day before. It just forced my mindset. So maybe the weather out there is crappy, but I know I have three things that I can be grateful for. And believe me, you all have. We are blessed. We are alive. We live. We have opportunities. So there's always maybe is that your dog was happy to see you. I don't know, or maybe your mother made your favorite plate. Or help with your laundry. I don't know, something like that. But you can be grateful. And I think that has been one of the tools that have helped me through my journey and on my life here. As a woman in surgery, I have to say that I had to find my allies, the people that will root for me, that will coach me, that will mentor me. And that's something that is an active thing you have to do. You cannot just sit in your office and say, there's no mentor. No, what do I need? Oh, I need a mentor in education. I want to be a future program director. Okay, so who's the best person that can mentor? And I had Dr. Stephanie Heller, former program director. But I also found allies within males because this is a male dominant world still here at Mayo Clinic, still in the United States, where we are getting better. It has improved significantly. We have also increased the number of female residents as well as female staff. But having a male that supports you means a lot. It really can change your path. So when you're looking at mentorships and support around you, it doesn't have to all be females. It doesn't have to all be males. They both can bring something to you. So be intentional about finding those allies that will push you and help you go through. I also learned that being different was my superpower. Coming from a different background was amazing. I could bring to the table, to the meetings, to the idea room. I could bring a completely different perspective, and I think that has teach me to look for more, to create more inclusive environments within the roles that I have, because I know how the being different feels. So I took that I don't fit here, I'm in a different culture, I'm not sure, into what are the really things I can bring here because I have that path, because I had that roller coaster journey. I stopped trying to fit in on who I am. I cannot get taller, I cannot get a blonde hair. Well, I guess I could. No, I'm not going to do that. I work on my language, but it is what it is. So as long as I'm doing a good job with a quality job, I am who I am every time I step out of this office. I learned about resilience and I learned about flexibility. And maybe I was doing it already since I started my journey earlier with my daughter, but I really understood what was resilience. How do I really learn from all of these events and make the best out of it? And have a flexible mindset. That has been a key to change and grow within my surgical world. There are a bunch of sacrifices, and as a woman surgeon right now in the United States, we go through a lot. Not the same as other female surgeons went through, but the reality is there. And you have to sacrifice, and sometimes you have to take a big deep breath, deal with a microaggression, learn how to speak up in microaggression situations. I also think one of the things I'm here is because the sacrifices of being at Mayo Clinic in Rochester, Minnesota, all of them, the sacrifices for me, I am happy with my sacrifices. And everywhere you are, or everywhere you go, or everywhere you practice, everywhere you live, there will be sacrifices. It could be the weather like me, or it could be something else. You gotta be happy with the weather, or you can have to be happy with that sacrifice. I think that's one of the key things that I preach that to my daughters. Like, you have to figure it out, what are the sacrifices of where you are, and can you live with those? If you can now live with the sacrifices, great. Find another place, but do the same exercise, because that other place will have other sacrifices. And find that place for you that you can be happy with the sacrifices, not with the good things. Everybody's happy with the good things. Happy with the sacrifices. My support has changed as through the years, because my needs have changed through the years, and that's another thing to think about. What you are right now, you could be a medical student, you might be in residency, you might be a research fellow, you might be in different stages of your life. When your needs are different, then find different support. Don't get stuck with the old people, not necessarily age-wise, but don't get stuck with the same. What do I need right now? Let's find that person or that tribe or that people that will support me in my needs now. And in the future, I will have different needs. I'll find different support. I found time, I learned the bad way to find time for me, to set up boundaries and think about my values and my why. And that has been something I have been doing as I mature into a mid-career surgeon. And that all helps when you go out there and you take care of patients, or in my case, teach residents. So I'll give you I'm going to shift my talk a little bit, and I'm going to give you a few things that are very practical when you fail. Because as I failed, and everybody failed, what we should be thinking is how I'm going to get up from my failures. And that, I think, once you figure that out, you can go through life, and life will be a success. So the first step to when you fail is that you're going to feel like this baby here, right? You want to cry, you might want to get angry and fight. Don't fight, no violence here. I'm not saying to fight with anybody. Go to a boxing class or something, get it out. Maybe you need to meditate, maybe you need to read, maybe you need to journal. But you have to go through those feelings, whatever those are. You have to not only acknowledge, but you have to feel the feelings, because you're not a rock. You're a person, you're a human, and humans and feelings go together. I was taught, from a generation, I adore my parents, but they are boomers and they still say don't cry and right. So I had to learn that, and I had to learn how to feel my feelings. So acknowledge those feelings. You're not a rock, you're a person. Take time to feel. After you take that time, I promise everything will pass. Regroup, restart, respond. For some people, that might look like taking a big deep breath, just stopping. You have gone through that journey of feeling horrendous. Now you stop. Now it's the calm. Now you start thinking about regrouping. This picture here, Puerto Rico went through a horrendous hurricane that it was devastating. And everywhere, this is a local beer, but everywhere it was like, we're regrouping, we are restarting, we're gonna get this done. After you pause, go back to the issue, to your failure, to what happened, and annotate. Make a note of the things that you have done. You had done some things. Don't do a to-do list. Do a done list. What are the things I did? I study hard. I read 3 books. I don't know. I was maybe a sport thing. I ran 9 miles. Write down the things you did, because in every failure story, you did something right. So acknowledge those things that you did right. And then go through the process of what went wrong, what you did wrong. Many times when we are in this process, we think, oh, so-and-so didn't like me, or so-and-so was not fair. That's probably true, because life is not fair. There's a lot of people there that are not going to be nice to you. That's a fact. Can you change them? Absolutely not. That's their business. That's their process. But what can you change within the context of the situation? I do list. So then in that situation, I do my second list, which is, what are the things that I did wrong? What are the things that I could potentially then learn? And in that process, learn to forgive yourself. It's okay. We're humans. Remember, we're not rocks. I failed. I did this right. I did this wrong. But I can forgive myself, and I can keep going. And you need to forgive yourself so you can learn. Because you really, this is difficult stuff. You really have to say, okay, I did it wrong. It's a shame. But I have to get away from that shame, and I have to learn to do it again. Or to whatever your next step is. And very, very important, I've said it multiple times, find your tribe. And your tribe could look like this with a bunch of numbers and names and cameras off, and that's okay, right? Or some nice pictures. This might be your tribe. The people here that have something in common with you. Again, it could be your family, like I show in my case, or it could be your support group, your colleagues. Find that people because you're not alone. When you go through different things in life, whether you're professional or personal, feel and acknowledge your feelings. Take a break, regroup, restart. Acknowledge what you have done, but most importantly, learn from your mistakes. The rest, unfairness, the rest of the people around you, that's noise. And you cannot do anything about that. Remember in this process to always, always, always forgive yourself. You're a human. And there's not a single person in this room who has failed or who have done a mistake. And I hope that with my story, you see that, yeah, I'm here at Mayo and I'm a successful surgeon, proud of it. But it was because I learned through my journey and that roller coaster to fail, to go down and figure out how to go up. And every time I go up, I go higher and I'm better because I can relearn and never, never, never do this alone. When I think about this talk, I want to think about my life and how I've got here. This is a message I really want to send to everybody in this conversation. Be brave and go for it. Your journey might be black, might be unknown, might be difficult and tough. Go for it. The best thing that you can do is try. Don't be afraid to fail because you will fail. You will. You're a human, and I've given you some practical things you can do when you will fail. Learn from your mistakes and others' mistakes. Oh, this person did this and that didn't work. Well, maybe I can do it differently, right? Stay true to yourself. Don't try to fit in. Find your superpower in being you and with your story. As women surgeons, I can tell you, you can be the change. We still have a big way to go. For those who do not identify with the female gender, sex, do know that we have our journey. Learn about it and be our allies and make it part of your own journey. Most important, be kind to others. Be kind to yourself. And never, 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 never give up. Don't listen to the people that tell you that you won't or that you failed. And with that, thank you for your time. Happy to answer any questions.
Oh, that was very, very touching, very impressive. Thank you so much for sharing your journey in life, I would say, not only in surgery, with us. That's very motivating to us all. Thank you so much, Dr. Rivera.
Dr. Rivera, thank you so much. We really enjoyed this. On a personal level, I'd like to thank you alongside Saliha. This, as a female, was very, very inspiring. Being a woman interested in surgery, this is inspiring on so many levels. So, thank you so much for being vulnerable with us. We really appreciate it. So, the first question we got was a female saying she faced a lot of misogyny, expressing her interest in surgery. Did you face any misogyny in your environment, and how did you tackle it?
Can you imagine being a single mother and in my culture, very patriarchal? So I did face that there. How did I handle it? Well, I had to reflect on what were those words, and I had to separate the person who was talking to me because many times it was the people close to me, right? And telling me no or telling me no because they really thought that that was the right thing to tell me, right, in that situation. So I had to put those two things away. It doesn't matter with how much intention or good they are when they're doing that. It's still misogyny, it's still patriarchy, right? It's still there. And then once you realize that, when you put it away from the person and you realize what they're really saying about you or telling you what to do or not to do, then that's where you go in and you say, okay, what do I want with this information or with myself? So I think misogyny is there. It exists. I don't think that it will be eradicated in my lifetime. I think you have to call it at what it is. Or this is a misogynist comment, or this is a misogynist act. Have language to you, and then separate.
Mm-hmm.
And again, you cannot change some people. Don't take people are not going to change, and change is their job. It's not your job. If you put effort in you trying to change others, I think that's a loss of time. Well, be a therapist then. Be a therapist and help them change. But even if you're a therapist, they have to come to you, right? So it is, don't waste your time on others. Figure out what those comments means to you and how you can do it. And then if you continue escalating in this role and you become a leader, you become a staff as a woman surgeon, then you have the opportunity to do the opposite. That's where I am right. I love this position of mine because then now I can be the opposite of this evidence, right? For my decision. Now is where I can do something about the culture. Now is where I can do something. But in that moment, even it still happens to me, separated from the person, that's noise. Understand, call it what it is, and keep moving forward. Make the change later.
Sure.
Next.
Thank you. Okay, so we have a question that's kind of more general. As an IMG, what would be the advice to give? Like, what can you do to put yourself out there?
Okay, an international medical graduate coming to the United States, right? That's what you're asking me, and to apply in the application of surgery. Okay, so the first thing that I would say from an advice standpoint is to really get familiarized with the process. Talk to other people that have gone through the process, who are now residents, or that have gone through the application, what things they did. Understand what your process you're signing up for, right? Because it's a journey, and you have to figure it out whether that is okay with you. Okay, I'm going to go to a different country with a different system, and I'm going to compete with all of these international medical graduates that are coming from all over the place. I am telling you, you guys are amazing, very well trained. But you're coming to a different system, and it will be the same that I go to your system. It's a completely different system. So familiarize with the journey will be number one. Number two, understand the American education system, which again could be not, depending on where you study, could be different. So that there's less surprises, right? What you're trying to do is familiarize with where you're going. After that, obviously, I'm going to tell you right now, it's an extremely competitive world. You have to get good grades. You have to get good grades in your medical school. You have to get good grades in your scores. You have to, because it's extremely competitive. That's the reality of it right now. The other thing to do is, who are the people who are competing? Well, they're coming from good schools, they're taking good grades, they're doing you good on the USMLE, they took some time to study, whatever you need. What else are they doing? Well, some people, not everybody, will spend time with research. One of the questions I always get is that, do you have to do research? The answer is no. Not everybody do research, okay? And some residencies will consider international medical graduates who just graduate from medical school to go directly to their residency as categories. I can tell you a few that went there. Now, that process, and I've had this question before, it's not a straightforward process. Every single residency will have a different process to do it. Mayo Clinic, I don't like to compare international medical graduates to the United States education system. I don't think it's fair. So I in that process, it's two groups, and then after the interview, then every single person that that was interviewed for preliminary, if they want general surgery, we do consider them for categorical, and then it's a process, it's a meeting. We take everything into consideration, and then we decide. We do, and that's the process of Mayo, but that's another process of everybody. Okay, there's going to be differences, and that's a thing that you need to understand. That part of this process is that it's not as straightforward, it's not the same. And then once you get into your first opportunity within the system, whether it's a research a year or whether it's residency, preliminary, or it's categorical, then obviously you have to do your best, right? You have to be responsible. You have to understand what is your role, what is the expectation from you. Maybe you're taking the time to learn the language. Perfect. Then use that time for that, and it's whatever you're doing, whatever you need. It's very personal. To take the best out of it. There is not a single way of doing this. If you talk to 5 international medical graduates successfully, you'll see that the 5 of them have a completely different journey. So keep that in mind. There's not a magic way of doing it. There's not just one way of doing it. There's multiple ways. So understanding the process, learning the system, and once you're in, doing the best that you can do with that system. Identify what are your strengths and identify your weeknesses and work on them.
Sounds great. Thank you so much, Dr. Rivera. Okay, one last question. Considering you have kids, and having a surgical career, have you ever regret Like, did you have any regrets when you went into surgery at any point in time?
Absolutely. The list is long. I have failed as a mother as many. That's another. That's another talk. Um. Yes, this it's hard. It's extremely hard to be a professional and be a mother, and I'll tell you why. Or a father, right? Or a dedicated father. It's not a woman thing. Raising a human being, it's a full-time job. And when you dedicate a career, which is a full-time job too, surgery has sacrifices because in my case, I could be 24 hours on call. I could have to come back because a patient of mine got sick, right? There's a lot that surgery asks from you and takes from your personal life. And that time is being taken away from your time raising a child. I think my regrets are that I didn't understand that early enough, that there was going to be so much to give up. And I have to give up personal stuff because I remember somebody asking me, what hobby do you have? What hobby I have? I have to raise 3 daughters. What do you mean? I have a profession and I have 3 daughters to raise. That's it. That's my life because these are humans. And they need my time, they need my attention, they need my love, they need all of those things. So the regrets are there, and you will not be perfect. And I am behind in my academic journey because I had to spend time, you know, raising my kids. I don't now. I don't think I regret my journey. I just have to say that during the journey, you do have regrets, and you go like, oh, I should have spent more time with me and my middle daughter during her this time of her life. And then I look at that time of her life. I was going through this, and it was maybe starting as a young staff. So the regrets will be there because there's nobody perfect. You do the best that you can with what you have. And my advice is, as a professional, whether you do surgery or not, you are a woman in medicine, whether it's again surgery or not. You are a professional. And your profession will take a lot of your time. There's not such thing as life balance. There's not. I do 2 hours here and I do 2 hours there. No, you do the best with the time that you can. Be a mother. Don't be the surgeon at home. That will be this something that I learned. Be the mother. Be mother. Be, I don't know, whatever mother is for you. Cooking or cuddling or playing or reading or whatever it is. Be that person. My daughters could care less how many people I did surgery on, right? Yeah, they ask me now and then, but what they want is mom. So I think the regrets are there. Would I change my journey and my pathway? I don't think so because I still love to be in the OR. I still love to teach. I still love that connection with my patients. So as long as I am still with that passion and loving and my job gives me so much, I'll still do it. And I will same with parenthood, with motherhood. I'm still learning. I'm still learning to be the best mother now in the different ages that they have right now. I wouldn't regret it. But there's a lot of regrets. But right now, I wouldn't do anything.
Thank you so much, Dr. Rivera, for your honesty and sincerity answering this question.
I would just like to say thank you so much, Doctor, for your time. It was an amazing talk. It was very, very, very inspiring. It really hits my heart personally as a female in surgery.
Hopefully, we can meet you in person, maybe here in Riyadh soon.
That'll be awesome. Well, you guys have a great day, whatever time.
Have a good day.
Thank you so much.